Hello, my name is Sarah and I am presenting for my team from the Interactive Data Lab. We have been researching the preferences and priorities of analysts in public health when creating and evaluating visualization recommendations. We conducted a user study to compare how well the priorities of users align with the design values embedded in visualization recommendation systems. Over the duration of our study, we find that participants value simplicity, relevancy, and analytic interest when creating visualizations and evaluating them. Users have a natural priors and biases in semantic knowledge in the dataset, and participants are more likely to engage in visualizations with positive results. To start off with the motivation of our work, there are many types of recommendation systems with different goals. So we have Tableau, Amazon Quick Insight, Power BI, Voyager, etc. However, do the priorities of these systems line up with what analysts and users want to see, and what do people actually want from these systems? We can boil this down to three primary research questions. 1, what do users actually want to see in a visualization design? 2, what do users value when it comes to evaluating existing visualization recommendations? And 3, how do visualizations created by analysts align with those created from other sources? So before beginning any experiment flow, we began with finding a domain and dataset. We think that a participant's recommendations will be contingent on their background knowledge and existing priorities. So we wanted to select a domain that was accessible to its audience as well as well-known within the field of study, thus limiting the effective dataset knowledge. We selected a dataset from the National Health and Nutrition Examination Survey for public health analysts. After selecting a domain, we addressed our research questions with the user study. We began with a tutorial of our selected tool. Jamboard is a simple and easy tool to use for sketching, uploading, and viewing images online. After exploring and becoming comfortable with the tool, participants explored the dataset. Upon exploring the National Health and Nutrition Examination Survey dataset, participants were asked to consider and rank the attributes they found to be the most important to recommend to a client who is developing public policy to improve health outcomes in the US. After ranking attributes, participants were asked to sketch 3 visualizations based on the dataset. The mediator would provide guidance on the given task and answer questions, while the wizard rendered the participant sketches using Tableau. The participant would provide feedback on the resulting visualization, and the wizard would iterate over the result until the participant was satisfied with their work. Finally, we asked participants to rank their top 5 visualizations based on their analytic value from a set of pre-made recommendations. These set of visualizations were generated by a mix of algorithms and humans, with the participant unaware of the source of each. After completing our user studies and organizing all of the data collected, we began our qualitative and quantitative analysis. So we analyzed our results qualitatively by coding interview transcripts and quantitatively by analyzing the Vega-like specs that come from participant sketches. So first, we qualitatively analyzed participant sketches, rankings, and experiment transcripts and notes. So we generated codebooks from sets of interview transcripts and then compiled those into an aggregate codebook. From this codebook, we generated a set of themes for analysis and discussion. Then we quantitatively analyzed participant visualizations based on their attribute selection, data transformation, and encoding choices. We extracted these features from Vega-like specs, generated feature statistics across the specs, and then identified patterns in the stats. We revisited our qualitative findings to support our observed quantitative patterns. Our qualitatively coded transcripts and quantitatively coded Vega-like specs allowed us to arrive at the following takeaways. First, visualizations should be simple with clear takeaways. Participants wanted visualizations that were easily understood by diverse audiences. One participant stated that they tended to use a lot of bar charts as the majority of their clients are not really data savvy. In fact, we found that participants primarily sketched and preferred univariate and bivariate charts, with bar and line charts being the most popular mark type selected. This is a visualization focusing on the mark type specified in our participants' visualizations after they were translated to Vega-like specifications. Our next takeaway is that visualizations should be relevant. Participants were client-driven and motivated by the anticipant need of their visualizations. For example, during the presentation and ranking phase of our study, participant 13 mentioned that they disliked visualizations that only provided demographic or physiological relationships because their client was looking for specific public health outcomes. The 2 visualizations here are examples of what the participant did not find relevant given the task. And finally, visualizations should be interesting and give the audience new and useful information. In this example, our participant ended up swapping the bar chart for a new visualization they created, as the education levels look the same across all of the body mass indexes. As a result, that particular visualization did not matter too much to them, and they didn't want to include it in their final set. So from these three major takeaways, we can re-examine the contributions of our work in understanding the relationship between users and recommendation systems. So in summary, participants value simplicity, relevancy, and analytic interest when creating visualizations and evaluating them. Users have natural priors and biases in semantic knowledge in the dataset, and participants are more likely to engage in visualizations with positive results. So what are the design implications for current visualization systems? So users have natural priors when looking at data. So how can systems integrate the context of a data set when recommending visualizations? So for example, in the context of our public health data set, users were interested in attributes that related to public health outcomes like diabetes, BMI, and heart attack. So how can we provide this information to our recommendation system so that they are aware of the specific meaning behind certain attributes? Because it is important to take into account the relevancy of certain data attributes given a specific task, and we want to make sure our systems are also taking this information into account. So thanks again to all of the folks who contributed to our study, and thank you for listening to this presentation.